Have you ever wondered about the dilemmas faced by adults managing chronic diseases? Imagine trying to navigate a complicated maze where every turn leads to a new challenge and every decision can significantly affect your health. That's the reality for millions of adults trying to manage chronic diseases. Chronic disease management is a complex process that demands a personalized and comprehensive approach. It's not a one-size-fits-all situation. Each person requires a unique plan tailored to their specific condition, lifestyle, and health goals. This journey can feel like a maze, full of twists and turns, with the need for constant adjustment and reassessment. We'll be taking a deep dive into the intricate world of chronic disease management, focusing on a range of conditions. We'll explore the cardiovascular labyrinth, where we encounter hypertension, coronary artery disease, valvular heart disease, mitral valve prolapse, and the intricate workings of pacemakers. Next, we'll venture into the pulmonary pathways, where conditions like asthma and chronic obstructive pulmonary disease lurk, challenging us with their unpredictable nature and treatment nuances. We'll navigate the endocrine enigmas, such as diabetes mellitus, where balancing blood sugar levels becomes a daily puzzle. We'll also tackle the hefty issue of morbid obesity and the multifaceted approach required to manage it effectively. We'll journey through the end-stage renal disease terrain, where managing fluid balance and electrolytes is key, and where dialysis or transplantation may become the only way out. We'll explore the inflammatory avenues of rheumatoid arthritis and the often overlooked corridors of alcohol and drug abuse, both of which pose unique management challenges. Finally, we'll delve into the world of immunosuppression, where conditions like cancer and AIDS demand vigilant care and a delicate balance between treatment and quality of life. As we embark on this journey together, remember, the aim is not to conquer the maze, but to learn how to navigate it effectively. The goal is not to eliminate the disease, but to manage it in a way that allows for a fulfilling and productive life. Stay tuned as we delve into these diseases and their management conundrums. Before we delve into the cardiovascular conundrums, let's take a detour to explore another crucial aspect of chronic disease management: the role of ambulatory anesthesia. It's not a term you might hear every day, but it plays a pivotal role in managing chronic diseases, particularly for patients undergoing outpatient procedures. Ambulatory anesthesia, or outpatient anesthesia, is designed to facilitate quick recovery, enabling patients to return home on the same day of the procedure. It's a critical player in the surgical management of many chronic diseases. Now, you might be wondering, why is this important? Well, many patients with chronic diseases often require minor surgical procedures, and ambulatory anesthesia makes these possible with minimal disruption to the patient's life. It offers several benefits, including patient convenience, lower costs, and reduced risk of hospital-acquired infections. However, it's not without its challenges. The fast-paced nature of outpatient settings demands precise anesthetic management to ensure patient safety and comfort. It requires balancing the need for effective pain control with the goal of swift recovery and discharge. Let's consider a case study. Mary, a 60-year-old woman with osteoarthritis who underwent arthroscopic knee surgery under ambulatory anesthesia. Mary's anesthetic management required careful planning and execution. Her anesthesia team had to consider her chronic disease, her medication regimen, and her post-operative pain management. It was a delicate balancing act, but with careful planning and execution, Mary was able to return home on the same day of her surgery, reducing her risk of hospital-acquired infections and allowing her to recover in the comfort of her home. As we can see, ambulatory anesthesia plays a crucial role in the management of chronic diseases. It's a testament to the incredible advancements in medical science and the dedication of healthcare professionals who continually strive to improve patient care. So as we navigate the maze of chronic disease management, let's remember the unsung heroes like ambulatory anesthesia, making life a little easier for patients like Mary. First up, the heart of the matter: cardiovascular diseases. Imagine a patient, let's call him John, a 75-year-old gentleman with a myriad of heart-related conditions. This isn't just a hypothetical scenario, but a real-life narrative playing out in medical facilities across the globe. John's health profile is a complex puzzle. He has hypertension, coronary artery disease, valvular heart disease, mitral valve prolapse, and a pacemaker. Each condition is an intricate piece of the overall picture, requiring its own unique management strategy. Managing John's hypertension isn't as simple as prescribing medication and sending him on his way. It's about monitoring his blood pressure, adjusting his medication as necessary, and ensuring that his other conditions aren't exacerbated by the treatment. Coronary artery disease throws another wrench into the mix. It's a condition that can lead to heart attacks or heart failure if not properly managed. John's doctors must constantly be on the lookout for signs of worsening disease and adjust his treatment accordingly. Valvular heart disease and mitral valve prolapse add another layer to John's cardiovascular conundrum. These conditions can cause heart palpitations, shortness of breath, and fatigue, symptoms that can significantly impact John's quality of life. As with his other conditions, managing these requires a delicate balance of medication and lifestyle changes. And then there's the pacemaker. This tiny device, implanted in John's chest to regulate his heart rhythm, brings its own set of challenges. It requires regular checkups to ensure it's functioning correctly, and complications such as infection or device malfunction can be life-threatening. Managing a patient like John isn't just about treating diseases, it's about treating the person. It's about understanding how each condition impacts the other, how each medication interacts, how each lifestyle change can make a difference. As we can see, managing cardiovascular diseases requires a delicate balance. It's a delicate dance of medication, monitoring, and lifestyle changes, all while keeping the patient's overall well-being at the forefront. It's a challenge, no doubt, but one that healthcare professionals rise to meet every day. And it's these challenges that make the field of medicine not just a job, but a calling. Next, we navigate the labyrinth of lung diseases. Imagine a patient, let's call her Jane. Jane is a middle-aged woman who has been dealing with both asthma and chronic obstructive pulmonary disease, or COPD. These two afflictions often intertwine, creating a complex tapestry of symptoms. Jane's asthma causes her airways to be persistently inflamed, resulting in sporadic wheezing and shortness of breath. Meanwhile, her COPD, a progressive lung disease, further obstructs airflow from her lungs, leading to a relentless cough and frequent respiratory infections. Managing these conditions is a tightrope walk. The treatments for one can sometimes exacerbate the other. For instance, the corticosteroids used to control asthma inflammation can increase the risk of pneumonia, a common complication of COPD. This intricate interplay between diseases presents a significant challenge for healthcare providers. It requires a delicate balance of treatments, close monitoring, and a dash of intuition. Managing pulmonary diseases is no easy task, as our case study illustrates. Now we look at the riddles of the endocrine system. The endocrine system, a network of glands that produce and release hormones that help control many vital body functions, is a wonder to behold. Yet it's not without its own set of enigmas, and one of the most common is diabetes mellitus. Consider a case study of a 50-year-old woman diagnosed with type 2 diabetes mellitus. She presents a typical picture: overweight, sedentary lifestyle, and a family history of the disease. Her body is resistant to the insulin produced by her pancreas, leading to high blood sugar levels. The challenge is not just about bringing down those sugar levels, but managing a host of related health issues that can arise from this condition. Managing diabetes mellitus involves a delicate balance of diet, exercise, medication, and constant monitoring. It's like walking a tightrope, where the slightest misstep can lead to serious complications. Hypoglycemia, a condition of very low blood sugar, can be just as dangerous as high blood sugar. It's a balancing act that requires careful calibration of medication, daily habits, and even emotions, as stress can significantly impact blood sugar levels. Then there's the risk of secondary health issues. Diabetes can lead to heart disease, stroke, kidney disease, and vision problems. The management plan, therefore, must extend beyond blood sugar control to incorporate measures to prevent these potential complications. Furthermore, there's the psychological aspect to consider. Living with diabetes can be stressful, leading to depression, anxiety, and a lower quality of life. Mental health support is a crucial part of diabetes management that often goes overlooked. And let's not forget the critical role of patient education. Patients need to understand their condition, the importance of compliance with treatment, and the potential consequences of non-adherence. It's not just about prescribing medication, it's about equipping patients with the knowledge and tools they need to take charge of their health. The complexities of managing diabetes are a testament to the intricate nature of the endocrine system. Let's turn our attention to the hurdles of morbid obesity. Imagine a patient, let's call them Alex. Alex, like many in their situation, faces a unique set of challenges. Their weight impacts not just their physical health, but their mental and emotional well-being too. Everyday activities become strenuous tasks, and underlying health issues like heart disease and diabetes are exacerbated. The management of these conditions becomes a balancing act for healthcare providers, who must consider the risks and benefits of various treatment options. For Alex, weight loss surgery may be a viable option. However, it's not a magic bullet. It requires significant lifestyle changes and a commitment to long-term follow-up care. It's about more than just physical health, but also about providing emotional support and helping the patient to adapt to their new lifestyle. As our case study shows, managing morbid obesity is a marathon, not a sprint. Next, we tackle the barriers of end-stage renal disease. Imagine a patient, let's call her Jane. Jane, in her late 60s, has been living with end-stage renal disease for the past 5 years. Her treatment plan involves a complex and challenging regimen of dialysis, medication, and dietary restrictions. The management of her condition is a multifaceted task, requiring careful coordination and constant monitoring. Dialysis, while life-saving, comes with its own set of challenges. It's time-consuming, physically draining, and can lead to complications such as infection or clotting. Jane's medication helps manage her symptoms and slow the progression of her disease, but they also come with side effects. Her dietary restrictions are another hurdle, requiring her to limit her intake of certain nutrients that her kidneys can no longer process effectively. In essence, every step in managing Jane's end-stage renal disease presents a roadblock. The management of end-stage renal disease is a journey filled with many roadblocks. Now, we explore the difficulties of managing rheumatoid arthritis and substance abuse. Imagine a patient who wakes up every morning with stiff, aching joints. This is the reality for those living with rheumatoid arthritis. Now, add to that picture a struggle with substance abuse. It's a sobering image, isn't it? These two conditions might seem unrelated, but they often intersect in the lives of patients. Let's consider the case of John, a 52-year-old man. He has been battling rheumatoid arthritis for over 10 years. He also has a history of alcohol abuse. For John, the pain from arthritis is unbearable, and he often turns to alcohol as a form of self-medication. This creates a vicious cycle where alcohol exacerbates his arthritis symptoms, leading to more drinking. Then there's Mary, a 65-year-old woman who has been living with rheumatoid arthritis for 20 years. She has a dependency on opioids, which started as a prescription for her chronic pain. Over time, her body has become reliant on these drugs. This makes managing her arthritis even more challenging, as her doctors need to balance pain relief with the risk of furthering her addiction. These case studies highlight the complexity of managing these conditions. Doctors need to tailor the treatment plans to the individual, taking into consideration their physical and mental health, their lifestyle, and their support network. This often involves a multidisciplinary approach, with input from rheumatologists, addiction specialists, and mental health professionals. These patients require careful monitoring, as both rheumatoid arthritis and substance abuse can have severe health impacts if not managed effectively. It's a delicate balancing act, one that requires empathy, understanding, and medical expertise. The road to recovery for these patients is often long and winding, filled with obstacles and setbacks, but with the right support and management, they can regain control over their lives and their health. As these case studies show, managing rheumatoid arthritis and substance abuse is a complex puzzle. Finally, we delve into the intricacies of managing immunosuppression. This is a realm where complexity reigns, and every decision counts significantly. Immunosuppression, as the name suggests, is all about the body's defense system being compromised, leaving individuals vulnerable to infections and diseases. It's like being in a constant battle where your army is short on soldiers. Consider, for instance, a patient grappling with cancer. Their immune system is already strained, fighting the invasive cancer cells. Add to this the impact of chemotherapy, which, while attacking cancer cells, also weakens the immune system. Managing such a patient's health is akin to walking on a tightrope. The goal is to suppress the cancer without leaving the patient defenseless against other potential threats. Then we have AIDS patients. Acquired immunodeficiency syndrome, or AIDS, is caused by the human immunodeficiency virus, HIV, which targets the immune system. In particular, it attacks the T cells, the body's key defense warriors, leaving the individual vulnerable to what we term opportunistic infections. These are infections that a healthy immune system would usually fend off, but in the face of AIDS, they seize the opportunity to wreak havoc. Managing an AIDS patient involves a delicate balance of antiretroviral therapy to keep the HIV at bay, while also managing any opportunistic infections that may arise. It's a continuous process of monitoring, adjusting medications, and ensuring the patient's overall well-being. These examples illustrate just a fraction of the challenges faced when managing immunosuppression. Each patient is unique, each disease presents its own set of complications, and each treatment regimen must be tailored to the individual's needs. It's a dance of precision, timing, and adaptation. In both these cases and in countless others, healthcare professionals are tasked with the immense responsibility of making critical decisions. They must weigh the benefits and risks of each therapeutic approach, always with the patient's quality of life at the forefront. As we can see, managing immunosuppression is a balancing act of its own. It's a journey filled with intricacies, demanding not just medical expertise, but also compassion, patience, and resilience. After examining these diseases, it's clear that managing chronic conditions is a multifaceted challenge. As we journeyed through the labyrinth of chronic diseases management, we honed in on the unique complexities each condition presents. Cardiovascular disorders with their myriad branches including hypertension, coronary artery disease, valvular heart disease, mitral valve prolapse, and the use of pacemakers remind us of the intricate network that makes up the human heart. Our exploration of pulmonary diseases such as asthma and chronic obstructive pulmonary disease highlighted the delicate nature of our respiratory system and how it can be impacted by chronic conditions. Endocrine disorders, particularly diabetes mellitus, underscored the crucial role hormones play in our bodies and how their imbalance can lead to serious health complications. We also took a deep dive into the challenges of managing morbid obesity, a condition that requires a combination of medical, psychological, and lifestyle interventions. The journey through the maze also led us to the complications of end-stage renal disease and the delicate balancing act required to manage this condition. Our path also crossed the intersection of rheumatoid arthritis and alcohol and drug abuse, showcasing how one chronic condition can often exacerbate another, adding another layer of complexity to management strategies. Finally, we ventured into the realm of immunosuppression, discussing cases like cancer and AIDS patients, where the body's natural defense system is compromised, creating a unique set of management challenges. Through all these case studies, one thing remains clear: managing chronic diseases is not a one-size-fits-all approach. It requires a comprehensive, personalized care plan that takes into account the individual's unique circumstances, coexisting conditions, and lifestyle factors. The management maze is indeed complex, with twists and turns at every corner. But it's important to remember that each step we take is a step towards better understanding, better management, and ultimately, better patient outcomes. Remember, while the management maze may be complex, every step forward is a victory.